wanted to just share some of our data with all of you. As you can see, we are continuing to experience this very welcomed trend in terms of the number of COVID inpatients continuing to decline week over week. So that is obviously great news. It's great news for us here at St. Francis Health System, but more importantly, it's great news for folks in the community because we do seem to be seeing fewer cases and for sure fewer cases that end up in our hospital. This again is a slide that just compares the same calendar date, 2021 versus 2020. So the blue line was a year ago at this time. And while the lines haven't yet completely converged, obviously the trends are, the current trend is in the right direction, the correct direction to get us back to where we were in terms of the number of inpatients this time last year. This is the other graph that I share. This is the number of folks that are requiring a mechanical ventilatory support. You can see the blue line, which was March of 2021, the third month of our surge that occurred over the end of the holidays and into January, compared to where we are in October. We continue to still see a fair number of folks that are younger in age that are requiring mechanical ventilation and unfortunately are requiring support for increasingly long periods of time. And this is the dashboard that also is on our intranet, which shows you just where we are today in terms of the total number of patients. One thing I'll point out again, the number of COVID patients is 152, but the number of inpatients, so these are folks in the hospital that are still in isolation, which is another way of thinking about they are still contagious from a COVID perspective. That number is about half. So what that says to you all is that we have a substantial number of folks that have been in the hospital for more than a week, more than 10 days. They are no longer a risk of shedding COVID and infecting anybody else, so that they're not required to be in isolation, but they are still too sick to be discharged and sent home. And then the last is on the bottom, just the age of the patients on ventilators, as you'll see, continues to be young from my perspective. 53 is our average age as of today. The next slide just again reinforces the total number of vaccine doses that St. Francis Health System has administered in the community. And so we're sneaking up on 100,000 doses of vaccine.
For more information, you can visit tulsaworld.com.